Okay, hi guys. Welcome to the midnight session. Okay, I hope everybody can see me. Yes. So can you see me, guys? Hi guys. Yeah. Okay. So yes. Okay, guys. So once you can see me, let's quickly have a rapid. Okay, so let's quickly see the questions that I had given you in the quiz today, and let's see if you can and look at how we were able to answer and what was your doubts. So let's go start quickly. Okay, so let's go to the question number one here. So this was a 5-year-old child, okay, who presented with multiple lymph nodes and peripheral smear blast was seen. These blasts were positive for PAS. So whenever I'm saying PAS positive leukemias, guys, obviously you have to see that whether it is a dot and blot positivity, because if it is dot and blot, then you know that this is ALL. Okay, whereas diffuse pass positivity is can be seen in AML, M6 and M7, right? So now pass positivity gives you some clue, but let's go read further. Okay, TDT positivity was seen in these blasts. So TDT positivity in the blast is very, very typical of ALL, guys, and both TLL and BLL cells are positive. Okay, so you have to remember that point always. So it is basically BLL and TLL both will be positive, but AML usually are not positive for TDT. They can be aberrantly positive rarely, but usually they are not positive. So here the answer to this question was AML, and I hope you will be able to answer that correctly here further. Okay, let's go to the question number two. Okay, so RBC precursors in the bone marrow are present in. So guys, whenever I'm talking about RBC precursors in the bone marrow, remember this point always. So whenever I'm talking about bone marrow, no, so this is the bone marrow. Okay, so these are the sinusoids. So remember the megakaryocytes. Okay, remember megakaryocytes are the largest cells, which I always call crocodiles of the hematology. So they are always present near the sinusoids. So these megakaryocytes always release their platelets in the sinusoids. Okay, so that's the location for megakaryocytes. Whereas when I'm talking about RBC, that is erythroids, they are always present around the macrophages. That's the location, okay, around the macrophages. You know why? Because these macrophages give iron to RBC. So they are also called as, these RBCs are also called as nurse cells. Okay, so remember that, nurse cells. And the nurse cell is the mother with along the erythroid. You remember this is what is called as erythroid colony. What is this called as? This is called as erythroid colony. That is a point that you should always remember. So RBC precursors are always present adjacent to the reticuloendothelial cells or macrophages. That is the answer that you should always remember. So if somebody asks you who is present adjacent to the sinusoid, remember it is megakaryocytes. Okay, that's the point. Other options were just googly. Now, next, let's come to the question number third. Abnormalities of which of the following RBC proteins are commonly seen with hereditary spherocytosis except? Now, this was again a very logical question, very important question, which was a tricky question, and many of the students did it wrong. Remember, guys, whenever I'm talking about the structure of RBCs, no, we have band 3 here. Okay, so this is band 3, and this is the spectrin proteins. Okay, so these are the spectrin proteins, and they connect to each other. If they have to see the connection, so there is and chirin here, and there is 4.2 here. Okay, so apart from that, there is anion exchanger also. Okay, anion exchanger, which is also like band 3 like molecule. So this is an ion exchanger. Okay, an ion exchanger is also there. Now 4.1 is basically important in the horizontal layering. So remember the mutations in all these which I have drawn, basically that is the vertical linkage. Okay, so any break in any vertical linkage will cause hereditary spherocytosis. Okay, so remember all of these can cause hereditary spherocytosis. So now look at the options which is not there. 4.1, so 4.1 is very, 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 very rarely associated with spherocytosis. Okay, it's a major, it's a translocation present in elliptocytosis. Okay, so it's not a major translocation of spiro, it's a translocation of ellipto. Remember that always. Now again a point here, again a very important question here that they ask you. What did they ask you is that if they ask you what is the inheritance of spherocytosis, it is autosomal dominant. Okay, that is the point that you should always remember. Whereas here is the catch point that you should remember and can be asked to you in exam. Okay, so alpha spectrin and 4.2, can be inherited in autosomal recessive. So autosomal recessive spherocytosis can be there. Yes, it can be there. And usually it is 4.2 and alpha spectrin, which can be autosomal recessive. Remember that point always. Okay. Now let's go to the next question. Okay. So what is this, guys? So this is a supravital stain. Remember that this is a supravital stain. So quickly tell me, what are the three things that can be seen on supravital stain? Supravital stain is new methylene blue, okay, or brilliant crescile blue. If somebody asks you what all can be seen here, remember reticulocytes. Okay, remember reticulocytes. Number two, HBH inclusions. Number three, Heinz bodies. Okay, so these are the three things which can be seen on supravital stain. Always remember that in your brain. Okay, so now if you're seeing golf ball inclusions, they are also called as HBH inclusions, and they are due to beta 4. Okay, so remember, I've already told you the story, who loves to play golf. Boys love to play golf. So boys are B4. So four boys go together to play golf. They are golf balls. Okay, so that is HBH, remember always. And who is Bart's? And who is Bart's, if somebody asks you? Bart's is a person who dies, okay? So he doesn't survive. So he's usually associated with Hydrops fetalis. So who does that? Gamma 4. Why? Gamma 4 is gone, okay? He dies. So gamma 4 is associated with Bart's. Remember that always, okay? So don't do that wrong, okay? So that's a very important thing you have to remember. Okay, and last question, what is Heinz bodies? They are denatured hemoglobin seen in G6PD deficiency, and reticulocytes are nothing but RNA which can be seen in your every hemolytic anemia has increased reticulocytosis. Again, important point you should remember, post splenectomy and post hemorrhage. Okay, so post hemorrhage and post splenectomy also you will have reticulocytosis. That's another point you should always remember, right? So that is about golf ball. Don't forget ever. I'm sure you'll not forget. Boys play golf. Okay, right? Okay. Now, let's come to this. What is this, guys? Come on, this is your parasite. Parasites are one of the favorite of examiners, and definitely in your pathology, one of the parasites is definitely going to come. So you should know that, okay? So now what is this parasite? You can see rings here, and you can see multiple rings here. So whenever you are seeing multiple rings in the RBC, remember, guys, that is always, this multiple rings is always falciparum, okay? Multiple rings are always falciparum. So let's look at the question now. So if I'm looking at the question, you have to remember. So if I'm talking about falciparum, guys, look at the question. So this was a question: 5-year-old child presenting with anemia and thrombocytopenia. On the peripheral smear, this falciparum rings are seen. Okay, so all of you know, majority of the time, gametocytes are seen. Okay, and gametocytes of the falci are always banana shaped. So you will have to remember. Okay, now. Divya Mansa, it's beta 4. We have already talked. It is beta 4 chains, no? Okay, beta 4 chains of the globins. Okay, right. Okay, so gametocyte of the falci are banana shaped, so that is correct. Double rings are seen in falci, that is very correct. Remember, double rings usually seen in falciparum. That's a very important point you have to remember. Okay, now, you have also heard of black water fever. So black water fever is very classically seen with falciparum. Okay, so yes, it is associated with intravascular hemolysis, and that intravascular hemolysis presents with hemoglobinuria, that is usually called as black water fever. The granuloma is not seen in liver; it is seen in brain. Okay, so the granuloma is a granuloma seen in malaria, and it is usually seen in the brain. Remember that point always. Okay, now let's go to the next question. So the next question is, which of the following has least chances of dry tap? Okay, least chances of dry tap. See, dry tap means whenever you are doing a bone marrow aspirate and nothing is coming out. Okay, so dry tap. So this could occur when the bone marrow is fibrosed, like in myelofibrosis. So name itself says fibrosis, that is bone marrow is fibrosed. Okay, right? And always you have to remember, apart from that, which all conditions can cause fibrosis again? Hairy cell leukemia. Okay, so hairy cell leukemia, and the second thing that you have to remember is AML M7. Okay, AML M7. So AML M7 and hairy cell leukemia all can cause fibrosis. So yes, they are associated with fibrosis. And of course, so now who has the least chances? Follicular lymphoma. So follicular lymphoma usually does not produce fibrosis, and so the bone marrow is usually cellular in that case. Okay. So here are some doubts which people are asking. Ma'am, supravital stain is confused with DNA particles sometimes. Uh, Supravital stains, no guys, supravital stains is something which is meant to see live cells. Okay, so you will be able to see it in the live form, and it is blue in color. That's the catch point of supravital stain, because it is usually stained with new methylene blue or brilliant glycine blue. Okay, so Shivank is asking what is a coal form. That's a very beautiful question, Shivank. Good. A coal is like the eyes of thyrotoxicosis. Imagine the eyes bulging out and only the cornea coming out. Okay, so like this. Okay, so a coal means when the ring is seen at the periphery. Okay, the nuclear ring is seen at the periphery. So imagine a thyrotoxic eyes with only cornea seen in the front. That is an acole. Okay, so that form is very classically seen in falciparum. Right. Okay. Now let's come to this. So the answer to that question was least chances of dry tap was follicular lymphoma. I hope everybody has understood that. Now let's come to the next question. Okay, so this was another question which many of the students did wrong. By the way, guys, the quiz is on Telegram if you want to see the questions. Okay, so you can go to my Telegram channel, which is Dr. Vandana Pathology, and you can see this. Okay, now coming to the next, which is not true for sickle cell disease. Okay, not true. Okay, so remember, guys, a high prevalence of sickle cell trait in Africans is due to protective effects against falci. That's true. Everybody knows that. Okay, so it protects against malaria, and that is why this was an adaptation. One band of electrophoresis suggests sickle cell trait. No, guys. So this will talk in a while. Let's go to the next option first. In heterozygous. Okay, so in heterozygous sickle cell trait, about 50% of hemoglobin is HbS and rest is A. Remember this clue always, guys, in sickle cell trait. Whenever I'm talking about sickle cell traits, okay, so sickle cell trait, the rule is A is more than S. Okay, so remember that rule. A is always more than S. Okay, and remember S is usually 40%. S is usually 40%. That's the rule. Okay, so whenever I'm talking about sickle cell trait, okay, remember this rule always. A is more than S. Remember that. Okay, and S is usually 40%. S is usually 40%. Okay, so rest, this option is correct. So infants do not become symptomatic. Why? Because they have mother's hemoglobin and they have high hemoglobin F. So him S doesn't like F, and plus A is there, so doesn't like A also. So polymerization doesn't occur and the patients are not symptomatic. So that's also true. Now coming to the diagnosis, which everybody did wrong, and many of the people did wrong, and you should know this. So let's go to the okay. Let's go to this. I'm going to go to the uh, image here. Okay, so first there was a question which came. Okay, so there was a question which came in AIMS November 2015, guys, which was related to the hemoglobin electrophoresis. And the question was, in a patient suffering with sickle cell anemia, the electrophoretic mobility of HbS in relation to hemoglobin A will be retarded, or will it be accelerated, or will it be same? So what is your answer? Think about the answer which you think should be the answer, and think in your mind and keep. And then I'll tell you the explanation. See, guys, what happens in sickle cell anemia is glutamic acid is replaced by valine. Okay, so you already know whenever we are looking at the movement of hemoglobin on electrophoresis, we see the movement from negative charge to positive charge, that is cathode to anode. So what happens is glutamic acid is more negative, so hemoglobin A negatively charged, so quickly runs towards positive because negative and positive interact, so it quickly goes and binds to the anode. Now what happens is when it is replaced by valine, so valine is a neutral amino acid. So what will happen? The mobility of this hemoglobin will be reduced. It will not move so fast. It will stay back. Okay, it will stay back. So therefore, mobility of HbS in relation to HbA will be retarded, will be decreased. That is the first point that you should remember. Now, once you're seeing this, now look at this. So we have two things. We have sickle cell disease and we have sickle cell trait. So I told you in sickle cell trait, you will have two things. A will be more than S. So you will have one band in A and one band in S. So you are seeing two bands. So whenever you're seeing two bands, it is sickle cell trait. Whereas in homozygous form, usually there is only two S, SS. So therefore you should see only one band, one thick band. Now In this patient, you can ask me, "Mum, why there's one more band?" So this is hemoglobin F band. You know what is the therapy for sickle cell anemia? You give hydroxyurea. So hydroxyurea increases hemoglobin F. So whenever, usually some, so in patients of sickle cell anemia, hemoglobin F is induced. Okay, so whenever the sickle cell, in patients with cell anemia, you give hydroxyurea and hemoglobin F is induced, then you can see a band of F also, which is fainter. But otherwise, for diagnosis, okay, whenever we have sickle cell trait, we have two bands, one in A, one in S. When sickle cell homozygous, we have only one band, one thick fat hen in the region of S. Okay, so one thick fat hen in the region of hemoglobin S. So that is what you have to remember in pathogenesis. Now, what is the diagnosis of choice? The diagnosis of choice is always hemoglobin HPLC. So HPLC will always help you seeing it. So if you look at the normal HPLC, this is hemoglobin A, and we have hemoglobin N, A2, and nothing comes after 4 minutes. Okay, but if you look at this hemoglobin now, so you see there is no A now, but you have a big band which is coming around 4.5. So this band which is coming at 4.5 usually, and there is no A, so this is probably sickle cell disease. This is probably sickle cell disease. You understand? That is the electrophoresis of, that is the HPLC of sickle cell disease. Okay, right? If you're talking of SC, okay, so SC will come even after this. Okay, so it will come beyond this. Okay, at 5 it will come, like, okay. So if they have two bands, and one at 4.5 and one coming at 5, then you should think of SC. Okay, so that will always get more complicated for at an undergraduate level. So let's not go to that level, but this is what you at least these are the points you should know in sickle cell. And of course, the spotter. Who is this? Identify this. These are the sickle cells that you should always, always, always identify, right? Okay. So once we're clear with this, let's come to the next question. Okay. So this was the eighth question and the last question of the quiz. This is a 60-year-old male who has lymphadenopathy, and on examination, translocation 1114 was seen. Which of the one will be positive? See, guys, if it was a multiple choice answer, then you would have marked both of them. Perfect. Okay, SOX 11 and cyclin D1. Perfect. That would have been correct. Okay, but if you have to mark one single best answer, go for SOX 11. Why? Because many mantle cell lymphomas nowadays are cyclin D1 negative. So cyclin D1 negative mantle cell lymphomas are also SOX 11 positive. So remember, SOX 11 is considered as one of the definitive marker for mantle cell lymphoma, which you have to remember. And of course, you have to see the translocation. So that's correct. CD200 is usually a marker which is seen in CLL, and CD10 will be seen in follicular lymphoma and Kala positive ALL. What is Kala? Common acute lymphoblastic leukemia antigen. So these are CD10 and CD200, which you should know. Okay. So Divya Mansa, in HPLC, the upper graph was normal HPLC of a normal person, and below one was sickle cell anemia. Everybody clear? Okay. Understood, everybody? So that was the short hematology quiz that everybody should know. Okay. And if there are any doubts, do let me know, and I'll be happy to take your questions if there are any, right? And if you're liking this pattern, we can have short revisions whenever I'm free at nights, right? So because this is one of my free time, so I love teaching at this time. And I must say you thanks for watching. So guys, tell me anything else you want to ask me right now, or you're clear with the quiz, right? Okay, so these were the 8 questions that I had given for quiz today. Okay, we'll have more such sessions, mostly about after 11 o'clock. Okay, guys, right? And thank you for watching, guys. Bye bye and good night. Yes, it is available, Gaurav. Okay, so bye bye, guys. Good night. Have a nice sleep or study well, or if you're studying, study well. So how to tackle these last days, guys, is try to study whenever possible. Try to study as much as possible. But even if you are not able to, read, or if you're feeling frustrated, if you're feeling exhausted, if you're feeling enough is enough, I'm done. So then, guys, I would say you that don't worry about it. relax. Okay, just keep doing some questions. Okay, because this will help you revising your points. Go, just keep flipping through your notes or last 10 points. Okay, give quizzes wherever possible so that you can learn some questions, and you never know that those questions can come in exam. So that will be a very good boost. Okay, I know this time is tough, guys, but it will definitely be useful later, and you will remember this time because this is the time you have worked most hard. Right, Arul, instrument revisions, we have to do it. Yes, definitely, I'll be doing the instrument revisions. How about tomorrow night, instrument revision? Yes. So if you're okay, we can do instrument revision tomorrow. Instrument techniques tomorrow night, guys. Yes. Okay. So tomorrow night, guys, 11 o'clock, we'll do instruments and techniques and some stains. Okay, so be ready for that quiz. We'll have a quiz first on Telegram so that you can attempt it. And after you have done, after you have done that, then we can, then of course after that we can discuss the questions here. So 11 p.m. tomorrow, instruments, techniques, we have already, although I've given the quiz, I'll repeat that quiz again, and I'll add some more questions, and we will discuss that quiz tomorrow. uh, okay, right, midnight, probably 11 o'clock. See you tomorrow, guys. Signing off. Bye bye, good night, and thanks for watching. Bye bye. Do subscribe to the channel if you haven't till now.